school because he's had seizure episodes, and people will laugh at him. He was chased after, and, he went through a lot of abuse, you name it, bullying, and in the end, he was taken out of school. Now, comparing my brother, who is 43 years old now, still living with epilepsy, well, less episodes at the moment with Jesus, but his epilepsy is still not controlled, basically. So my mom is a full-time carer for him. Now, comparing my brother and my son, who lives with me here in UK, I still feel that my brother could have had a better life if he was diagnosed at an early age, because he's been having seizures from 3 days after he was born, and he's 43 years now. So comparing the two situations, I still believe that if he had the care and the medication and the diagnosis and everything that he needed, maybe he will be in a better situation today. So this is how my passion started. And obviously there we did not know that was called epilepsy. I started doing a lot of research, and I just, I care about people living with epilepsy, and I can wake up any day and do anything for anybody living with epilepsy. Now, part of this organization that we are trying to form, Dr. John Jabang is the vice president, who is a consultant neurosurgeon and a pediatric neurosurgeon at the main hospital in the Gambia. Within our group, we do have ambassadors who are readily available to help with anything that we need. They are basically people that are specialized in certain skills, whether it's IT or marketing or doctors. We do have a quite good number of ambassadors who are happy to help at any point that we can tap into. Now, our executive members consist of 12 people in the capacity of strategy, finance and funding, outreach, research, and advocacy. Next slide, please. Now, our vision is to ensure that many or all Gambians are adequately informed about epilepsy, and ensure that those living with the condition are given the optimal support and care. We all know what it's like, and listening to all the previous presenters, we can clearly see that the stories are similar. People, the awareness is quite low. People don't know much about epilepsy, so when caught in a situation, most people don't know what to do. Our mission also is to encourage and promote community sensitization on epilepsy, and to improve the lives of any affected through financial support, health promotion, advocacy, research, and policy. Next slide, please. Now, with GESS, our objective is to make sure that there is individualized epilepsy care plan for patients. In terms of advocacy, we want to raise awareness and create an environment where people with epilepsy can come out with their conditions and don't feel discriminated or looked otherwise. We all know that, the myth related to epilepsy is they're all unfounded. And our aim is to make sure that people understand more what epilepsy is about, so that everybody will feel that they're being listened to and they're not being discriminated against. Now, in terms of support, we're looking into whether it's education, financial support, social support, or skill support, anything that we can provide for people living with epilepsy. Now, in terms of policy, we want our governments to start to talking, the talk needs to start in regards to epilepsy as a serious condition, and to accept it as a disability, and also to have a national plan, for people living with epilepsy. And this will include schools, workplaces, and basically everywhere. Next slide, please. Now, so far our journey, I have to say, we have been very grateful, and we really, it's been really good that we are a member of the Epilepsy Alliance Africa. through the Epilepsy Alliance Africa, we're exposed to a lot of stories, a lot of organizations, whether it's an NGO or doctors, a lot of information as well regarding epilepsy, which has really helped us to stand on our feet. We have a group of vibrant, passionate, dedicated, active volunteers around the country who are willing to take up responsibility anytime. So that is really promising. Our Vice President, Dr. John Jabang, is associated, well, he lectures at the University of the Gambia and working at the main hospital. I think that's really key in terms of what projects that we take on in terms of research to make sure that it's ethical, and any action that or any projects that will be taken in the future, we will make sure that it's credible and we have all our accountable. It's all accountable and records are kept for future references. Now, both Dr. Jabang and myself are members of other associations, so we bring our experience to this organization that we're trying to build and make sure that it's actually consistent and basically sustainable. We do have a website that is under construction, and hopefully once that's up and running, our audience here and members of the Alliance can actually log in and see how far we have come. Next slide, please. Now, the challenges that we're facing, lack of funds. We all know that without funds, we cannot do much. You need money to be able to make a difference, basically. And that's one of the main challenges. And like Natalie was saying, with COVID-19, a lot of organizations have held back on sponsorship and donations. So far, with our registration, or all the expenses have been paid for with contribution within our members. Now, another challenge in Gambia is lack of data. In the Gambia, there is no record at all, or there is few information about epilepsy. Now, previously, people with epilepsy were seen at the main hospital by psychiatric doctors, and I think that's the record of patients. That's basically how much records that we have at this present time. Now, lack of trained healthcare workers. At the moment, we don't have a single Gambian trained as a neurologist. And, that is really key for me. I'm not sure if there is any epilepsy epilepsy care nurses. I don't know of any. And like I said, these are all, this is a new organization and we're trying to find out information as we go.